Thank you, Your Excellency, the President of the Republic of Kenya, Dr. William Samoei Ruto, my friend, Deputy Secretary for Health, Director CDC Cohen, Prime Cabinet Secretary, senior government officials from both Kenya and the United States of America. Today is a profound day for us to be here, meeting here to discuss and celebrate our collaboration, especially the Ministry of Health with CDC and the United States of America. Your Excellency, could not have come at a better time than now. As we sit here, the world is now converging to discuss national health regulations, to discuss the pandemic treaty. And all this is to build consensus for members around the globe to be able to prevent, to detect, and to respond to public health emergencies. We have here, Your Excellency, at the Emergency Operations Center. So, Your Excellency, as a country, we have taken the steps of the CDC, and we are now establishing our National Public Health Institute, and it's just to ensure that we are able then to be together with the world as they prevent, they detect, and respond. Your Excellency, infectious diseases do not know geographical boundaries. It doesn't matter whether you're in Kenya or you're in America. COVID taught us the lessons. So it is for us as Kenya, CDC, and the United States of America people to work together to ensure that in future, should we have future threats, then together we are able to surmount that. CDC, I want to thank you on behalf of the Ministry of Health for the collaboration with Kenya Medical Research Institute that is represented here to Songok. You have worked very well with us to build our capacity through the FELTEP program. You have worked very well with us to build our capacity, and we are forever grateful. How do I see the next steps, Your Excellency? We now have a baby, the National Public Health Institute. Our success will be measured on how we collaborate and ensure the National Public Health Institute is able to respond to emergencies as they occur. Your Excellency, I have had the opportunity to say to the Deputy Secretary, she did visit our ministry, together with Cohen, the Director of a long chat on our plan for universal health coverage. And we did agree that now they are going to plan and build into our priorities. I'm so happy that finally the programmatic areas that we've been having, the vertical responses on HIV, on malaria, reproductive and maternal health, today we are going to find a future where we work together to ensure that we protect our people. Thank you very much.
Thank you so much, Health Minister. So to set the stage for the next part of our discussion, we're going to be going from the large picture of the U.S. government investment, which is about $600 million a year investment, to what is needed for a sustainable Kenya-led health programming. We want to make sure that we're focused on transferring sustainable health programs to the government of Kenya for country-led implementation and ownership. And one country-led programming is creating opportunities for local manufacturing of health commodities. So now I want to welcome Dr. Atul Gawande, Administrator, who's going to discuss the topic of regional manufacturing.
Your Excellency, colleagues, two things that COVID taught us were about the importance for sustainability of regional manufacturing of medical capacity available at the ready when crisis hits, and the importance of strong primary healthcare systems that connect, that deliver on that capacity. Today we're reflecting on the success of our joint partnerships in both of those domains to try to the celebration of the remarkable leadership, Pres.Ruto, you have made in both these domains. I've seen you speak from part of incredible knowledge about these areas. First of all, to comment a little bit about how you're leading the way on primary health care. You have set up 4 laws that have dramatically changed the landscape. First of all, by committing to more than 100,000 paid community health workers, an extraordinary standard. It's raised the bar for the entire continent. And you are not only making sure they're paid, you are making sure that they are part of a digital health information system where the electronic records are in their hands. And then furthermore, that they are part of primary care networks that link them to every other health system. They become the outreach to the community and the eyes and ears of the entire system. And that is a process that we are all across the U.S. government of being part of. When I visited Kenya last November, out of 315 primary care networks that were established as a goal, there were 26 with support from USAID, CDC, and the Department of Defense. I'm proud to say that now 151 primary networks have been established, 2/3 of which are with the support of USAID, CDC, and the Department of Defense. Now our teams are working together to build that capacity. Can't do anything if they don't have supplies and goods that are needed. And you are also leading the future of what our partnership can be with countries across the world for building capacity. Revital Healthcare is a prime example of what that future looks like. It is a Kenyan company based just outside of Mombasa with a USAID grant of $2.2 million and another $2.2 million in matched funds from Revital itself. The company built the largest medical diagnostic manufacturing plant in Africa. Capable of producing 240 million test kits per year. Further, Revital has developed its diagnostic tests for HIV, malaria, hepatitis B, hepatitis C, dengue, syphilis, and pregnancy produced on-site in places like Revital that have given the U.S. PEPFAR program to set a goal to purchase a total of 15 million African-made tests in 2025 and an estimated cost of $20 million from African manufacturers. And so with that kind of commitment to significantly expand purchasing by these programs, USAID is working with the WHO, the US FDA, the Global Fund, African manufacturers, and regional accreditation and regulatory bodies that manufacturers like Revital can manufacture global quality approved tests for serving the needs of Kenya, Africa, and the U.S. President's malaria initiative is likewise actively investing to increase the number of malaria commodities like tests and treatments made on the continent. Africa is home to 94% of the world's malaria cases, but the majority of malaria cases are imported from elsewhere. And so in the last year, PMI, as the program is called, has doubled its purchasing of African supplies for anti-malarial drugs and treatments. For example, from the Kenyan manufacturer Universal Corporation Limited, and from also another Kenyan Life Sciences. This also includes work with Revital as it goes through the process to achieve WHO pre-qualification for malaria rapid tests, which will enable them to be candidates for procurement by PMI in the future. These approaches, the commitment, all of the connections that had to be made are nothing short of transformative. Not only are we building health systems to deliver quality as possible, but we're supporting industries that can equip those systems. Kenya's leadership setting the pace. As Kenya's economy continues to grow, we're going to see mutually beneficial skills, technology transfers at the foundation of relationship. And one company that I've mentioned already leading the way in these new future partnerships is Revital Healthcare. I'd like to turn it to Harsh Mehta from Revital. He's the Director of International Business Development and can talk a little bit about what Revital is doing.
When we started in the year 2008, it was only 2 million medical devices per month. We're now manufacturing and exporting more than 200 medical devices per month. The positive impact is to ensure that our own country and our own continent receives adequate medical supplies. Africa is a continent with high disease burdens in the world. We've got malaria, we've got HIV, we've got hepatitis. These are all three communicable diseases that's killing millions of people within Africa, reasons why? Because adequate testing is not done. So establishing this facility with the USAID Kenya team, we're now ensuring that there is always going to be kits throughout the continent. We also want to ensure that our country grows economically.
Through USAID, we have continued to increase the number of jobs here at Revital Healthcare. Currently, with 650 people working at Revital, with 80% of that being female, Revital is introducing 200 new jobs, prioritizing female employment, but also putting an emphasis on speech and hearing impaired individuals.
Revital has really impacted the way this will really push me to expand my career in future. I get to share this knowledge with my family, with my community, and also to educate this awareness how to use the product.
Good afternoon, everyone. As you already know, my name is Harsh Mehta, Director of International Business Development at Revital Healthcare. I stand here today with the 650 people working at Revital as their representative and the voice of the chairman himself, who's sitting right in front of me. Thank you so much for having us here today, and thank you so much for giving the private sector here in Kenya the opportunity to actually speak and voice our own opinions as well. Being a part of this stage and being a part of the members on this stage itself is something that holds a lot of weight. It's true greatness that I have towards the left of me over here, and as somebody as young as me right now, being able to actually speak is also a big opportunity for us at Revital. Thank you so much for everything that has been done from USAID, PEPFAR, and the work that has been done over the past couple of years that has allowed us to put ourselves on this platform today to make sure that we can make an impact in Africa for Africa. Now, as I move forward with our comments, I'd like to say that why Revital and why is there so much emphasis on Revital over the past few years with USAID? Revital has been focused on making sure we continue to provide accessible, affordable, and child and life-saving medical devices on the African continent for the first time. And providing support for people, and that has been our core value all the way throughout the past 16 years in operation. Now, during this time, we've managed that we support vulnerable demographics across the rest of the globe and make sure that we provide maternal and child health for Africa for the first time. Now, in addition to that, we've increased our capabilities with the products that we've been manufacturing and the know-how that we have had made us these leaders here today. Now, as we move forward, we've always had an initiative which is to support the Kenyan government with the products that we're at. Now, over the past couple of years, and especially after Your Excellency Pres.Ruto, you have managed to ensure that local opportunity for local procurement and preferential procurement for the first time, especially for us manufacturers here in Kenya. Now, that so much weight and so much confidence on a local manufacturer such as us, because it gives us the confidence to continue to move forward, as well as provide more investment, more jobs, more socioeconomic benefits, and more economic development within the country itself. The technological advancement that goes into medical manufacturing has been seen before, and with the support of USAID, we've managed to ensure that we're now going into the manufacturing of rapid diagnostic test kits for the first at an end-to-end scale for Africa ultimately. Now, as we have moved forward, our capacities has grown rapidly. We have 1 billion medical devices manufactured annually. We have touched approximately 600 million lives in 2023, which is the impact that our manufacturers do in Africa for the first time. Now, additionally to that, having all the different certificates has enabled us to export globally to 30 countries across the globe. Now, support has always come from partners. Having true key partners is what makes private sector perform at the highest level. Partners such as the government of Kenya, from Your Excellency President Ruto, this has enabled us to give us that confidence to move forward, but also from the likes of the Gates Foundation that helped build the capacity for our 0.5 ml vaccine syringes, that ensured that there is capacity for immunization campaigns across the entire of Africa. That enabled us to increase our capacities to 330 million units of the 0.5 ml vaccine. Now, that with USAID coming on board, with the technologies that we're developing, again, this will create even more jobs and even more technologies for Africa for the first time. Now, I want to pledge something which is what Dr. Atul, you have mentioned. Revital promises to have an ERPD and WHO pre-qualified HIV rapid test kit in 2025 to support PEPFAR's initiative for 2025 for local procurement in Africa. Now, even more importantly to that is we're putting a flag, or we're putting Africa on the map, and we're putting Kenya on the map. Technical leader in the manufacturing of medical commodities that are so highly required. We're reducing our over-reliance on the East, and we're reducing our over-reliance on foreign exports, and now finally locally manufacturing, which has been strongly been supported by, again, the government of Kenya, as well as our friend here, Professor Songok from KEMRI, to make this a reality here. Now, as I now conclude, this is not what we want to continue doing at Revital. This is not where we stop. We will always try and push the technology and more Africa and develop healthcare security in Africa through centralized warehouses and